Hi everybody, Dr. Britt Talley Daniel MD, a neurologist and a headache doctor. Today I'll be talking about the vascular safety of Aimovig or Aimovig, which is the generic name for migraine prevention. During the talk I'm just going to use the name brand drug Aimovig because it's not generic yet. So there's been a question, although these drugs have been used well and very safely and work very well in patients, it's been a question as to whether or not they have any cardiac or vascular side effects. Because when the drug first came out, most of the studies then were done just on general population migraine patients, but not specifically on heart patients. So this drug is a CGRP antibody, and that's a drug that blocks one of the neurochemicals that come out in the brain. I'm going to show you a picture of this just on my slide thing here. This is what I call the migraine timing cycle, where one is central pain. One is trigeminal activation, Two is neurochemical release, and CGRP is one of the three neurochemicals that's released. And three is causes meningeal vasodilatation. And then four, it causes central pain transmission or inflammation of the thalamus. And those are the four steps of the migraine process. I have articles written just on that are on my webpage. All right, so here we go. First, I'm going to talk a little bit about what chronic migraine is. Chronic migraine, according to the International Classification of Headache Disorders, is 15 or more headaches a month, 8 of which have migraine features. And migraine features are usually severe headaches. On a scale of 1 to 10 migraines over 5, it may be 10, but some of my patients have said they're 20 or 30 or something, trying to relay to me the sad experience of migraine being a very disabling, terrible headache. The headaches may be one-sided, associated with nausea, vomiting, sensitivity to light and sound and smell. All right, so 8 of these headaches have to have migraine features, whereas episodic migraine is less than 14 headaches a month. Well, we know that these neurochemicals are released during the migraine process because they've stuck a needle in the jugular vein after a migraine was started chemically. They gave the patient a drug that started the migraine and then looked at the jugular blood coming from the brain going down the liver, and they could find all these neurochemicals in there. As I've said before, the original research with Aimovig was just general migraine patients, but not anything specific about cardiovascular effects or cardiovascular patients. So a lot of doctors have questioned this in the headache literature, and it's been going on about a year. And I have some articles here that will show the result for this. So the question is, what is the safety of Aimovig with vascular disease? So recent studies have found that Aimovig in both general and vascular migraine patients did not increase the risk of adverse events. So what are the drug interactions with taking Aimovig anyway? What comes if you give the drug? What happens? Well, I've been practicing medicine 50 years, and this drug has no drug interactions. Wow, I've never had drugs like that in my life. And so it's made by DNA polymerization. It's given by injection in the body subcutaneously, either around the belly button or in the leg. Well, the side effects from taking Aimovig. Well, serious side effects are hypersensitivity reaction. Those are very rare. Common normal side effects are injection site reaction. It's like a tiny bruise, like you have blood drawn out of your arm. Constipation, about 3% first couple of months. Occasionally muscle cramps or spasms. Well, what about migraine? Is that associated with an increased risk of vascular events? Yes. Go to my blog article at drmigraine.com and bring up this article I have in there on migraine comorbidities. It lists all the medical problems that are found with migraine. So migraine is comorbid, which means associated with many cardiovascular diseases or situations, like stroke, particularly ischemic cerebral infarction. That's just like a stroke. With migraine with aura, that risk is increased by 6%. Hypertension, which is one of the common risk factors for the development of atherosclerosis, which means hardening of the arteries, has a 10% link to migraine. Angina, myocardial infarction. Angina is organic heart disease with symptoms of chest, arm, or chin or back or pain that comes, but it's not really a heart attack, but it relates to heart disease. Myocardial infarction is a medical term. We call it an MI. In a lay term would be a heart attack, and signifies damage to heart tissue. The exact mechanism of which migraine with and without AR are associated with angina and myocardial infarction is unknown, but it is clinically and statistically relevant. Also Raynaud's disease, the Raynaud's phenomenon associated with migraine. Those are neurovascular symptoms relating to constriction and dilatation of small arteries. Persons who have congenital heart disease. That's a common heart condition found in 1.5 to 2% of the population, and most patients doesn't cause symptoms. But it can have in most patients it can have congenital heart disease with a right to left shunt or left to right shunt, and that's patients who have the need probably for a valve or some kind of heart surgery later in life. Mitral valve prolapse is a common heart condition found in 1.5 to 2% of the population. Most people doesn't cause symptoms. This is what I got mixed on a while ago, sorry. It results in the descent of part of the mitral valve on the left side of the heart between the small chamber of the atrium and the large chamber where it pumps blood into the body. Mitral valve prolapse symptoms are chest pain, rapid heartbeat, and anxiety. Again, the relationship between mitral valve prolapse and migraine is uncertain, but it has a valid relationship. Also, patent foramen ovale, PFO, is found in as many as 25% of persons early in life, and it usually closes by itself on its own. So this is a little hole that connects between the right and the left part of the ventricle. Some patients will have PFO extending into adulthood, and at that age may be associated with migraine. An atrial septal defect is statistically related to migraine, but surgery is not needed for that. So what are the benefits of taking Aimovig, just for clinical benefits? Well, they've been really remarkable. Half of the patient would get a 50% reduction in migraine headaches. Another 25% of patients would get 75% reduction in headache. Another 25% of the so-called super responders would get 100% reduction in migraine. I've seen a population of migraine patients who are having 5 to 10 migraines a month and would chart it and come see me, and I'd work with them, and I was giving them everything we had at the time to try to treat that, along with adjusting their lifestyle, because that's an important part of treating migraine, and couldn't get any better at that. But I'd see some of these patients back after 3 to 6 months. They haven't had a migraine at all. Not all of them, but most patients had a great response to it, and these drugs have been very important. So the first article I'm talking about is written by Kudrow et al. It was in Neurology just about a month ago. It's now February 2020, so it was like January 2020. The title of the article was Vascular Study and Safety of Aimovig for Migraine Patients. And this was a vascular safety report. Doctors collected data from 4 clinical trials which lasted 12 weeks. And they studied 2,443 patients with a year history of episodic or chronic migraine in North America, Europe, Turkey, and Russia. They excluded patients with vascular events in the previous 12 months, and then had an independent committee who analyzed patient adverse events. So how were they treated? Well, half of the patients were given placebo, which means like sugar water, and the other half were given standard Aimovig treatment, subcutaneous, so it was either 70 or 140 milligrams once a month. So what were the results? The 3 groups had similar rates of adverse reactions in general and vascular adverse events specifically. The result as listed in the Journal of Neurology was, and I'm going to quote this study examined the vascular safety of Aimovig in migraine prevention trials. Aimovig does not increase the risk of vascular adverse events, period. The results of this safety provide some evidence that CGRP receptor inhibition did not aggravate myocardial ischemia in at-risk patients with stable angina compared to placebo, and contribute to the growing body of evidence supporting the safety profile of Aimovig, said Dr. Amal Starling at the Mayo Clinic in Arizona, who's a co-author of that study. Another article or report on was written by Dupree, Writing and Headache, in 2018. The title of their article was A Randomized, Double-Blind, Placebo-Controlled Study to Evaluate the Effect of Aimovig on Exercise Time during a Treadmill Test in Patients with Stable Angina. So they gave these patients studying their heart exercise time, looking at their EKG while they're exercising, and they're studying that. He stated at that time, this was early when the drug first came out, that the relative importance of CGRP receptor pathways during myocardial ischemia hadn't been previously established. Dupree's methods were an exercise treadmill test following a single infusion of Aimovig or Aimovig 140 milligrams or placebo, and they followed the clinical symptoms in the EKG. He presented a 12-week randomized double-blind study in which 89 patients with stable angina were assigned to a single injection, followed by an exercise treadmill test. Reassuringly, Aimovig had no adverse effect on exercise time to onset at all. It also didn't affect the heart rate or the blood pressure during exercise. So his conclusions were that Aimovig did not adversely affect exercise time in a high cardiovascular risk population of patients, supporting that inhibition of the CGRP receptor does not worsen myocardial ischemia. So, the bottom line here is that Aimovig is safe to use for migraine patients with vascular risk factors, which is great news, and now that's been studied well. So, if you don't mind, follow me by clicking on the subscribe channel down there, and I'm also on my blog at www.drmigraine.com. Good luck to all you. God bless you, migraine patients. Thanks for listening. See you again on the next one. Bye.